This is truly a labor of love. If you're pregnant, and especially if you're nearing your due date, there's some things you've got to take into consideration as we gear up for this storm. Dr. Alan Patterson from West Boca Medical Center. I mean, listen, you talk about a waiting game. There's some moms out there that are really on the brink. What should they be doing at this point?
Well, it is very stressful. It just depends what your situation is. Everybody has a different situation. I'll give you two examples. A lady, it's her first baby. If she's 38 weeks, 2 weeks from her due date, she's not having contractions. Her doctor checks her, does his or her due diligence and checks the patient, and the patient's cervix is long and closed. She should stay at home because she's probably not going to go into labor, and staying at the hospital is stressful.
Yeah.
If you stay at the hospital, you have to bring a sleeping bag, toiletries, everything to do. They do the best they can, the hospitals, but you're in a big room with a lot of people. You're sharing a bathroom with who knows how many.
Oh,
so it's not the
gosh.
best situation. So that lady should stay at home, as opposed to somebody, maybe it's her third baby. She's been having contractions every day. Her doctor checks her. She's like almost all the way thinned out, 90% thinned out, 3 centimeters dilated. She has a ripe cervix. That lady could go into labor, so that lady needs to go to the hospital because she doesn't want to get caught in labor. So two different people, two different situations. But if you can, if you don't think you're going to go into labor, your doctor doesn't think you are, which you should talk to your doctor at this time, you're better off staying at home in the comfort of your home or somewhere safe, because the hospital is not the Ritz or the Boca Resort, you know, during these few days.
And listen, been there, done that. I cannot imagine what some moms are going through right now. I don't know. It just sounds like you almost have to get somewhere and sit down.
Right. You want to, if you're going to be at home, you want to relax. You want to stay well hydrated, and now's not the time to do a lot of exercise that could put you into labor, because the first thing we do when we try to stop contractions is we put people in bed and we give them IV fluids. So relax, stay at home, drink lots of liquids, try not to get stressed out, which is, you know, going to be impossible, but the more you can relax and take your mind off it, if you're in a safe place, you're better off in your own home, unless if you're at your due date or past your due date, then you need to go to the hospital because you're more at risk to go into labor. But people that are a couple weeks before, if they're not having contractions, if their cervix is long and closed, they're better off staying at home.
And at this point, hospitals are not inducing, correct?
No elective inductions right now. If somebody is sick, all of a sudden somebody's blood pressure goes up, or there's a problem with the baby and the baby has to be delivered, then they will do it. But there's no elective inductions when you're on hurricane watch or hurricane. And eventually, you know, at some point the hospitals will be locked down, so you won't be able to get into the hospital.
True or false? A hurricane can make you go into labor earlier?
Well, possibly. Some people think the change in the barometric pressure can make people have contractions, or your water breaks. So you're better off staying at home, relaxing, staying well hydrated, no extracurricular activities or too much activity, because you don't want to irritate your uterus. If you're at home, you want to keep your uterus quiet so you can get through the hurricane, and then it doesn't matter.